Hi everybody, it's Dr. Rizvi from Advanced Foot and Ankle Centers of Illinois. Today we're going to talk about a fractured foot as well as the toes. And so what a fractured foot or toe is it could be a simple crack in the bone. It could also be something more severe with the fracture going completely through the bone and sometimes even the joint. And so some of the reasons you can have a fractured foot, it could be something as simple as a fall or something as complicated as a car accident. It could be a heavy object falling on the patient's foot. It could also be from repetitive motion. For example, marathon runners or people that are very active over time can also have what's called a stress fracture. And so if the fracture is severe enough, or if the fracture is going through a joint at times, the patient may need surgery with plates and screws. However, we try to do our treatment as conservative as possible. Some of the signs and symptoms of a fractured foot will obviously be pain. There's going to be some tenderness, bruising, a lot of swelling to the affected area, and the patient will be unable to walk, or it's very painful for the patient to walk. As I mentioned, in our office, we like to do things more conservatively, and so we have a lot of conservative options for the patients. And so how a visit would work for somebody who might have a possible fracture is initially we get x-rays. We review the x-ray with the patient in detail, and kind of describe the location and the severity of it, and then we come up with a plan on how to heal the fracture. And so a lot of times we'll do an offloading boot, which takes all the pressure off the patient's foot. This will allow the body to heal and also allows the patient to move around a little bit. One of the other more conservative things we can do is a bone stimulator. A lot of times if the patient is trying to avoid surgery as much as possible, a bone stimulator will help promote the growth factors that allow for significantly more healing than without the bone stimulator. It's very conservative, it's external, and patients do really well with that as well. And that's usually reserved for if the fracture isn't healing the way we want it to. And so, as I mentioned, in our office, we try to heal the fracture in a more of a conservative manner if we're able to. And we have a lot of different options on how to do that. And so, if you or anybody you know has a fracture or a possible fracture, come see us at our office. Thank you.